name is Elena, and I am here on behalf of Planned Parenthood's program Teen Advocates for Sexual Health, which is more commonly known as TASH. TASH provides high schoolers with discussion and information on comprehensive sex education. This includes not just the standard topics, like STIs and contraceptive methods, but also topics including LGTB rights and dating violence. TASH also gives teens the opportunity to advocate in their community by participating in events such as the filibuster today. 2 years ago, I decided to join TASH after feeling endless frustration with the confusing messages our society promotes about sexual health. I was listening to friends talk about inaccurate sexual health information and feeling pressure to uphold unrealistic standards society imposes on teen sexual health and mentality. Joining TASH was arguably one of the best decisions I've ever made for myself. Not only have I been empowered by learning how to take care of my own sexuality, but I've also been able to advocate for my peers. I think it's ridiculous that the government is focusing so much energy on restricting women's reproductive rights, when we should be focusing on creating laws that would help ensure everyone has the ability to lead a healthy and safe lifestyle in whatever way they believe is best for them. At TASH, we are constantly advocating for comprehensive sex education in our school systems. Evaluations of comprehensive sex education programs show that these programs help youth delay onset of sexual activity, reduce the frequency of sexual activity, reduce number of sexual partners, and increase condom and contraceptive use. Importantly, the evidence shows youth who receive comprehensive sex education are not more likely to become sexually active, increase sexual activity, or experience negative sexual health outcomes. Effective programs exist for youth from a variety of racial, cultural, and socioeconomic backgrounds. Researchers studied the National Survey of Family Growth to determine the impact of sexuality education on youth sexual risk-taking for young people ages 15 through 19, and found that teens who received comprehensive sex education were 50% less likely to experience pregnancy than those who received abstinence-only education. Researcher Douglas Curtin from the National Campaign to End Teen and Unplanned Pregnancy examined studies of prevention programs which had a strong experimental design and used appropriate analysis. 2/3 of the 48 comprehensive sex ed programs studied had positive effects. 40% delayed sexual initiation, reduced the number of sexual partners, or increased condom and contraceptive use. 30% reduced the frequency of sex, including a return to abstinence, and 60% reduced unprotected sex. Advocates for Youth undertook the exhaustive reviews of existing programs to compile a list of programs that have been proven effective by rigorous evaluation. 26 effective programs were identified, 23 of which included comprehensive sex education as at least one component of the program. The other programs were early childhood interventions. Of the 23 effective comprehensive sex education programs, 14 programs demonstrated a statistically significant delay in the timing of first sex. 13 programs showed statistically significant declines in teen pregnancy, HIV, or other STIs. 14 programs helped sexually active youth to increase their use of condoms. 9 programs demonstrated success at increasing use of contraceptives other than condoms. 13 programs showed reductions in the number of sex partners and/or increased monogamy among program participants, and 10 programs helped sexually active youth to reduce the incidence of unprotected sex. Where there's ample research to prove that comprehensive sex education programs give young people the tools they need to protect themselves from negative sexual health outcomes, there is little, if any, evidence to show that flawed abstinence-only programs are effective, even at achieving abstinence among teens. A congressionally mandated study of 4 popular abstinence-only programs by the Mathematica found that they were entirely ineffective. Students who participated in the programs were no more likely to abstain from sex than other students. Evaluations of publicly funded abstinence-only programs in at least 13 states have shown no positive changes in sexual behavior over time. In December 2004, the U.S. House of Representatives Committee on Government Reform, led by Representative Mary A. Waxman, released a report showing that 80% of the most popular federally funded abstinence-only education programs use curricula that distort information about the effectiveness of contraceptives, misrepresent the risks of abortion, blur religion and science, treat stereotypes about girls and boys as scientific fact, and contain basic scientific errors. Among youth participating in Virginity Pledge programs, researchers found that among sexually experienced youth, 88% broke the pledge and had sex before marriage. Further, among all participants, once pledgers begin to have sex, they had more partners in a shorter period of time and were less likely to use contraceptive or condoms than their non-pledging peers. No abstinence-only program has yet been proven through rigorous evaluation to help youth delay sex for a significant period of time, help youth decrease their number of sex partners, or reduce STI or pregnancy rates among teens. Public opinion polls consistently show that more than 80% of Americans support teaching comprehensive sex education in high schools and in middle or junior high schools. In one poll, 85% believe that teens should be taught about birth control and preventing pregnancy. In another, 7 in 10 oppose government funding for abstinence-only programs. Support for comprehensive sex education also cuts across party lines. In a poll of 1,000 self-identified Republicans and independents, 60% of Republicans and 81% of independents think that public schools should teach comprehensive sex education. The health and future of every adolescent is shadowed by risk of sexually transmitted infections, including HIV, as well as by risk of involvement in unintended pregnancy. The rate of STIs is high among young people in the United States. Young people ages 15 through 24 contract almost half of the nation's 19 million new STIs every year, and the CDC estimates that 1 in 4 young women ages 15 through 19 has an STI. Experts estimate that about 1 young person in the United States is infected with HIV every hour of every day. Nearly 15% of the 56,000 annual new cases of HIV infections in the United States occur in youth ages 13 through 24 as of 2006. African American and Hispanic youth are disproportionately affected by the HIV and AIDS pandemic. Although only 17% of the adolescent population in the United States is African American, these teens experienced 69% of new AIDS cases among teens in 2006. Latinos ages 20 through 24 experienced 23% of new AIDS cases in 2006, but represented only 18% of U.S. young adults. A November 2006 study of declining pregnancy rates among teens concluded that the reduction in teen pregnancy between 1995 and 2002 was primarily the result of increased use of contraceptives. However, new data from Centers for Disease Control and Prevention's National Center for Health Statistics show that teen birth rates are again on the rise. The NCHS reports a 5% national increase between 2005 and 2007 in teenage birth rates in the U.S., from 40.5 to 42.5 births per 1,000 young women aged 15 through 19. Approximately 1 in 5 teens report some kind of abuse in a romantic relationship, with girls who experience dating violence having sex earlier than their peers, less likely to use birth control, and more likely to engage in a wide variety of high-risk behaviors. Research clearly shows that comprehensive sex education programs do not encourage teens to start having sexual intercourse, do not increase the frequency with which teens have intercourse, and do not increase the number of a teen's sexual partners. At the same time, evaluations of publicly funded abstinence-only programs have repeatedly shown no positive changes in sexual behavior over time. Young people need honest, effective sex education, not ineffective, shame-based, abstinence-only programs.
Hi, my name is Erin. I'm here from Kansas City, and I'm participating in the Women's Filibuster today because I believe that a woman has the right to make her own private medical decisions without the interference of politicians. And on that note, I'd like to call Governor Nixon to veto HB 1307, which would triple the mandatory waiting period for a woman to receive an abortion, which does nothing to protect women's health, but only pushes an abortion further into a woman's pregnancy. Furthermore, this dangerous bill also does not provide exceptions for victims of sexual assault, and we'd like Governor Nixon to veto.
Hi, my name is Vivian Wheeler. I'm from Springfield, Missouri, and I'm a volunteer with Planned Parenthood. And I am here today to ask you what we are teaching our girls and women in Missouri. This legislative session has seen an unprecedented attack on reproductive rights. By introducing over 30 anti-choice bills, the legislature is trying to tell us we don't have sovereignty over our own bodies. They're trying to teach us that we are thoughtless, rash, don't know how to make medical decisions with careful consideration, that we don't know what is best for our own bodies? Well, I am here to teach them a lesson. We know what a world looks like where safe abortion isn't available, and we, the women of Missouri, we will not go back. The champions of these horrific bills have squandered their chance to make real and meaningful change by focusing on the 72-hour abortion delay instead of passing Medicaid expansion. They clearly care about playing politics more than they care about the 250,000 Missourians that would gain access to health care through Medicaid expansion. I hope the guilty parties learn their lesson before the 2015 legislative session.
Good afternoon. I'm Paula Giannino. I'm the President and CEO of Planned Parenthood of the St. Louis region and Southwest Missouri. I'm extremely proud to be here today and represent our outstanding staff, our volunteers and interns, our board of directors. Right now, as I speak, our staff are in counseling rooms, meeting with women who are trying to exercise their right to safely go right now at this very moment. 1 out of every 5 women who comes to us, to our Surgery Center in St. Louis, the only licensed surgery center to provide abortions in the entire state of Missouri. 1 out of every 5 women who comes to us travels almost 150 miles to get to us. 1 out of every 10 women that we take care of every year travels over 300 miles to get to us. Why? Because of the shortage of providers, and also because of the skill, the extraordinary skill of our physicians, their training in being able to provide all types of abortion care, including mid-trimester abortion services, where there's almost no physicians, very few physicians, within a 300 or more mile radius of us in a nonprofit setting. We know what the impact of the 72-hour mandatory waiting period bill will have on the lives of the people that we take care of. What's sad to me and what's sad to us every day is that women don't understand why they have to wait. They really are surprised when we tell them the hoops that they have to jump through in the state of Missouri. In my 24-and-a-half-year career at Planned Parenthood, I've come to think that maybe the last burden that we'll put on women is one last gasp of breath before they can come safely into our facility and have the open arms of our staff greet them with warm smiles and a true sense that we care for you and we will take care of you because we're Planned Parenthood. Women don't understand the 24-hour waiting period that we've had to deal with for the past several years. We know the devastating impact that it's had on our patients, that it's had on couples, that it's had on families. Men don't understand the waiting period when they try to come and assist their partners or their daughters. And so now we're faced with the threat of a 72-hour mandatory delay that we know this week historically have passed both chambers. As I walked to the Capitol today, there is a statement over one of the walls that says, "Be just and fear not." And I really thought a lot about that. Be just and fear not. I don't think that's how we feel today. I don't think that's how women feel in Missouri. We're a state that's gone backwards fast. We were the first state in the country to completely dismantle, and defund its family planning program that was taking care of so many women who were falling through the safety net. Women who had no insurance, women who weren't eligible for Medicaid. These services were being provided by organizations like Planned Parenthood, and they literally were a lifeline for women who were trying to take control of their lives and their health and their futures. But our legislature completely defunded that program. Our legislature almost every year in my tenure has passed another difficult, devastating law that further restricts or tries to shame or tries to impose burdens upon women so that we make it harder, we make it more expensive, and now we are pushing women further back into their pregnancies. By the way, a law that is against medical advice and a law that is completely against the sentiment of common sense citizens. So I'm here today to thank our extraordinary staff who do this work, our courageous physicians who take care of the women of this state and from every state who comes to us. We know the impact that this law will have, and because we know, and because it is our job to speak out on behalf of the women that we serve and for all women in this state and in this country, I pledge that we will do everything we can to try to ensure a successful veto of this bill, and if we are fortunate enough to be successful, I pledge that our organization will do everything it can over the summer to work with the governor to sustain that veto, because the lives and the futures and the health of women in this state and other states depends on this work. And I ask all of us to do the same, to make that pledge. To make a pledge today before you leave the steps of this magnificent Capitol that we all love. I ask you all to make a pledge that you will do everything you can over the summer to help us with that work, because we're going to need everyone's best effort. Finally, I'm so proud of the public policy staff from our organizations that have played such key roles in planning, coordinating, and implementing this terribly important 72-hour citizen filibuster. I couldn't be more proud to be with you here today, and I'm humbled by your commitment, your incredible hard work, the kind of compassion and passion that you bring to the work that you do each and every day. I am happy to yield.
Thank you, Paula. Hi, my name is Mevy Mead, and I'm a member of Women's Voices Raised for Social Justice, and I work with Planned Parenthood. And we are bringing our historic, epic 72-hour women's filibuster to a close. And I just wanted to reflect a little bit on what's gone on over the past 72 hours and why we are here. We are here because since the beginning of the Missouri legislative session in 2014, over 30 bills attacking women's health have been not just introduced, but advanced. And they have been spending hour after hour attacking women's health while they've had no opportunity, or while they have ignored the opportunity to protect women's health by expanding Medicaid. Women and men and teens across Missouri have been trying to make our voices heard inside that building all legislative session. And unfortunately, they haven't been hearing us, and so we decided we needed to make our own voices heard, have our own women's filibuster to get our point across that they should be prioritizing women's health, sexuality education, Medicaid expansion, and not 72 hours. We have had people up all night, up early in the morning. We've had people from all over the state travel hundreds and hundreds of miles as women do to seek abortion, to come here and make their voices heard. We've had rabbis, we've had doctors, we've had all different kinds of people, men, women, teens, come and join in the Citizens Filibuster to really kick off an effort to protect women's health in Missouri and let the elected officials know that we're not going to find it acceptable for them to attack women's health while failing to act on Medicaid expansion and prevention policies. 72 hours ago, we heard from an amazing leader and powerful spokesperson for this initiative. We heard from Liz Reed Katz, who shared her personal experience about why tripling the mandatory delay is a cruel and heartless approach to people who are facing things that go wrong with their pregnancy, or for women who have survived rape or incest. Liz Reed Katz really set the tone of the women's filibuster and really got us off on, I thought, a fantastic start. And so Liz Reed Katz is coming back to bring this 72-hour filibuster to a close, and I am honored and touched and pleased to yield this mic to Liz Reed Katz.
After an introduction like that, I'm a little nervous. Good afternoon. My name is Liz Reed Katz, and 72 hours ago I stood here and opened this filibuster with my personal abortion story. I am deeply honored to have been asked to come back for the closing remarks. I was asked to speak at this filibuster not because I am unique, but because I am like so many of you. I am a college graduate, a dedicated wife of 7 years, a stay-at-home mom to a wonderful 18-month-old, and a woman who has made a heartbreaking choice to have an abortion 3 years ago. After 5 years of marriage, my husband and I decided it was time to start a family. We were so happy to get pregnant quickly, but all that changed when at 16 weeks we found out the baby I was carrying had trisomy 18, a chromosomal defect that is incompatible with life. It was after much soul searching and with a heavy heart that after talking with my husband, family, and rabbi, that I decided to have an abortion. It was not a decision I made lightly, but one that I made because it was in my best interest, my family's best interest, and because I love my baby so much, I couldn't stand the thought of her being born in pain and agony and to only ever see the walls of a hospital. It was a heartbreaking decision, but one I would make again if I was ever faced with it. Those who have voted for these unnecessary bills think that Missouri women aren't strong or smart enough to make their own medical decisions. We are. I thought long and hard about that decision, but once it was made, my will never faltered. An additional 72-hour wait, extra ultrasounds, mandatory videos would not have changed my mind. They would have just caused me more pain than I was already going through. I share my story because what happened to me could happen to anyone. And I would hate for them to have an even greater burden of a 72-hour wait placed on them. When I went through this, I felt so alone. But I really wasn't. If I had just looked around, I would have seen all of these Missourians who stood with me today. I want to thank them. Thank you. Thank you to the thousands of Missourians who sent in letters, called, and met with legislators to urge them to stop playing politics with women's health care in this session. Thank you to Women's Voices Raised for social justice for ensuring that myself and all the others who came out to filibuster were able to do so safely. And thank you to the ACLU of Missouri, Progress Missouri, and Planned Parenthood advocates in Missouri for standing with Missouri women and ensuring that our voices be heard, not only here in Missouri, but worldwide. It's been incredible. 72 hours ago, I started speaking, and with a lot of help from my friends, we haven't stopped. Consider this. What if 72 hours ago, when I started, a woman had walked into an abortion clinic? These past 72 hours would have felt even longer to her, would have been far more agonizing and emotionally and possibly physically painful. A woman chooses to have an abortion because it's her last option. It is the only answer to a problem she is facing. How will I care for this child? How will I feed this child? How can I bring a child who will only know pain and suffering into this world? All a 72-hour wait will do is cause more pain. It won't give her a solution. Governor Nixon, we need you now more than ever. Missouri women are watching, and we urge you to veto this dangerous bill. Thank you to everyone who has been watching this filibuster and to everyone who has shared it on social media. This might be the end of this women's filibuster in Missouri, but in no way is this the end of our fight. This is just the beginning.
Woo!